Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
For the first time in nearly a decade, more nurses and midwives are leaving the profession in the UK than joining it. The Nursing and Midwifery Council says working conditions, workload and poor pay are some of the reasons given. Sarah Smith reports.
For years, the numbers registering to work as nurses and midwives have been going in one direction, up. And with increasing demands on our health service, that's been crucial. These latest figures showing more staff leaving than joining should, according to the healthcare union Unison, ring alarm bells with the government and could signal a staffing crisis. Between last March and this, the numbers on the register dropped by more than 1,700. Over the following 2 months, there was a more dramatic move, the number going down again by more than 3,000. It's only a small proportion of the total number of nurses registered, but it's the significance of the downward trend which is causing concern.
There is a great demand for the right standards of care to be delivered across the UK. If the numbers continue to fall, then clearly some action needs to be taken to reverse that trend.
In a survey of staff who had left, for those not retiring, the biggest factors were working conditions and disillusionment with the quality of care provided to patients. Low pay was also mentioned. The highest proportion of leavers were British nurses. Of EU nurses surveyed, a third quoted Brexit as a reason for going. In a statement, the Department of Health said it has launched a national programme to ensure nurses have the support they need to continue their vital work. Sarah Smith, BBC News.
Thanks for your comments this morning about this pay cap and the fact that there is pressure now from various Conservative cabinet ministers to lift it. Pressure on the Chancellor, pressure on the Prime Minister. Craig on email says, as a teacher, I have not had a pay rise since I joined the profession, but MPs have had an 11% pay rise. Teaching is now unbearable and so many are leaving. You also ask how we're going to pay for any increase. I do not remember the BBC asking how we are going to pay for the bombs we sent to Syria recently. This texter makes a similar point. MPs had a 10% pay award. The Lords claim £300 a day on expenses. Public service employees deserve the same consideration. And Paul emails to say, while I agree that public sector workers should get a bigger increase, it's not only the public sector that's been affected. I haven't had any pay rise in over 8 years now, and I'm far from the only one I know. I'm getting fed up of hearing about the poor public sector workers when they've actually done better than me over the last few years. Do keep those coming in. Thank you very much for those. As I said, Mrs May under increasing pressure to end that pay freeze. It was announced back in 2010. It means teachers, nurses, firefighters, police officers and other people who work for the public sector have had their pay capped at 1%, even though inflation, the cost of living, has risen more than that. Foreign Secretary Boris Johnson has become the latest senior cabinet minister to put pressure on the Chancellor and the Prime Minister to end it. The Conservatives went into the general election pledging to maintain the cap until 2020, but there are growing calls for a rethink after the party lost its majority at the election. And it comes as figures from the Nursing and Midwifery Council show more nurses and midwives are leaving the profession in the UK than joining it. A basic salary for a new nurse in 2010 was £21,176 a year. In 2016, that figure was £21,692. That's an increase of just over 500 quid. Whereas MP salaries were £65,738 in 2010 and £74,962 in 2016. That's an increase of almost £9,000. As you know, not all MPs took that extra money, that rise. Some donated it to charities or used it in their office on interns and so on and so forth. Right, let's talk to Josie Irwin from the Royal College of Nursing and Maria Caulfield, who is a Conservative MP and a former nurse herself, and Alistair Smith, who's an economist and former member of 4 pay review bodies. Welcome, all of you. Josie, why are nurses leaving?
I think nurses feel that they've been taken for granted for far too long. The worrying thing about the figures that are out today is that more younger nurses are leaving, so it's not just nurses towards the end of their career. Workload pressures are enormously intense. Nurses are working extra hours every shift in order just to get the work done. It's an incredibly pressured environment.
So it's just too much and the pay's not worth it?
It's just too much, and 59% of our members, we know because we've surveyed them, feel that they're no longer able to deliver the kind of quality of care that they really want to, that they've been trained to, so they feel really compromised by the impact of the squeeze on their profession. And of course some are leaving because of the economic circumstances as well, but in reality it's a complex mix of not enough money, feeling undervalued, and just not being able to do the care, provide the care that they've been trained to do.
And the impact on the NHS of this?
Well, our view is that the NHS is at a tipping point, quite frankly, and it's not going to take much.
I feel like I've heard that before, though.
Yeah, this time it's really true. There are 40,000 vacancies, nursing vacancies in England alone. We know that the number of nurses coming to the UK from the EU are not coming in the numbers that they were, for obvious reasons, because they're uncertain. There are about 35,000 nurses who were EU trained, who are now feeling uncertain about their future, who will go. That on top of the 40,000 is just not believable.
We
really.
don't know that 35,000 will go.
We don't know that 35,000 will go, but we know that a fair proportion of them will go because they feel uncertain about their future.
Maria Caulfield, hello.
Hello.
Michael Gove, Environment Secretary, seemed to support yesterday calls for the cap to be lifted and said we don't necessarily have to pay for it by raising taxes, which means diverting money from elsewhere or more borrowing? What do you think he means?
I mean, there are some difficult decisions to be made because the reason why there has been a pay freeze, and you know, I suffered that when I was working as a nurse during the 2010-2015 period, and it is extremely difficult. You know, most nurses work, as Josie says, extra hours, extra shifts, join their hospital bank.
Sure.
To
so would you support the freeze being lifted, the cap being lifted?
Absolutely.
So where would you get the money from then?
So there are difficult decisions to be made because we're currently paying about £46 billion a year on the interest on our deficit, and if we suddenly start spending on everything we want to, then you know we're going to have to pay more in terms of interest payments as a country. But it's about priorities, and for me, public sector workers have been carrying their services, whether it's teachers, doctors, policemen, for too long.
So would you raise taxes? Michael Gove says we don't necessarily have to do that. Would you divert some money from elsewhere, the foreign aid budget, HS2, replacing Trident, or would you borrow?
I think that it's about priorities, and I think there is money in the system, and it would be about...
Tell me, where do you think?
I mean, for me, for example, I think we do need to probably look at the international aid budget. I'm very supportive of it, but I think, you know, there's...
So it's £13 billion last year.
Yeah, and there's...
What do you think it should be in order to fund
I mean, we
lifting
know
the cap?
that if we lift the cap, that will cost about £6 billion. It's not all going to come from one budget. It's about picking and choosing your priorities. But for me, I don't particularly want to be raising taxes because it'll be ordinary nurses, teachers, police officers who'll be paying the extra taxes. We've done a huge amount about lifting people out of tax and the lowest paid out of tax. I think it would be a retrograde step to go back and increase tax.
All right. So you say take some money from the foreign aid budget. I mean, that's taking money from some of the poorest people in the world.
Yeah, but we know...
I mean, as you know, you're a representative of the Royal College of Nursing, Josie. Would you be comfortable with that?
I think that Maria's explained it very well. There are political choices to be made. Making a political choice is always difficult. We would say that in order to deliver the healthcare that patients in this country deserve, the money needs to be found from somewhere. But that's not our decision. It's Maria and her colleagues.
But how would you sleep at night if money was taken from some of the poorest people in the world to pay your members?
I think, as Maria said, there's some tough political decisions to be made.
Let me bring in Alistair. Hello. In terms of your experience of pay review bodies, what do they look at before coming up with a recommendation?
Well, they look at the kind of evidence that you've just been discussing. Whether in the workforce that they're looking at, whether there's a problem of holding on to the staff they already have, whether there's a recruitment problem, and they get evidence from the Treasury of how much public money is available to to pay to spend on pay, and they weigh up that evidence and come independently to a view on how much of a pay increase should be given.
It may be impossible to answer this, Alistair. I'm going to ask it anyway. Josie said there is 40,000 vacancies.
That's right.
In terms of nurses. So in order to try and correct that, and it is a slow process, you can't just employ 40,000 people for tomorrow. How much would pay have to go up in order to attract new people into nursing? Or does it not work like that?
No, but it does work like that, but you're not going to get a straight answer from me, not because I want to avoid it, but because that's the job of the pay review body, to spend some months looking at the evidence and making that kind of judgment about what level of pay is needed to address a recruitment problem, if indeed there is a recruitment problem.
OK. All right. Thank you very much. I've just got a couple more comments here. Bear with me as I log into this tablet. It doesn't stay... Oh, there it is. Right, OK. Where is it? Here. I mean, a lot of people, actually, Maria Caulfield, are asking, how come MPs aren't public sector workers? How come they haven't been subject to the same pay cap?
I mean, I'm not sure why that is. I'd be very supportive if they were. I didn't take the pay rise when I first got elected. I gave it to local charities because I felt, having just come from the NHS with a pay freeze for the 5 years that it was there, I didn't feel it was right that I should take it when former colleagues were not getting one. So I'm not sure why that is. But I think, you know, I personally feel that MPs should be reflecting every other public sector worker, and if they're not getting a pay rise, then I'd be very happy if MPs didn't. But that's a personal view rather than a kind of a party political one.
God forbid. Right, this texter says we're a country who is unable to provide basic care for those who need it in hospitals because of funding cuts, and now we're told that nurses cannot be paid a living wage yet. Taxpayers pay more and more to fund the royals and their lifestyle. Can we still afford them? Mike says now is the time to look after our own. Foreign aid needs to be slashed for a few years until we have our own problems sorted. And final one for now, public sector workers are the people the country turn to in times of disaster and danger. NHS staff, fire service, prison officers, police, all protect and care for the public. It's time to pay them back for their commitment and bravery. Thank you very much, all of you. Thank you. Thanks for coming on the programme.